Tonight we're learning new details about the state of Oroville Hospital's finances. Action News Now reporter Bea Barbosa shows us how a notice recently sent to the hospital could be impacting healthcare in Oroville.
Nearly $200 million. That's how much Oroville Hospital was told they must immediately pay to United Missouri Bank National Association, or UMB, last Wednesday. In a notice of acceleration sent last week, UMB claims that Oroville Hospital has defaulted on payments for the $195,630,000 bond they took out in February of 2019. The bond was taken out by the hospital to fund the construction of its newest addition, the 5-story tower that broke ground in 2019 and was nearly completed in March of this year, but is yet to open. In the notice, UMB also claims that Oroville Hospital failed to deliver, as required, audited financial statements and a related compliance certificate within 150 days of the end of both the 2022 and 2023 fiscal years. I reached out to both UMB and Oroville Hospital for confirmation on what this means, but neither replied. Officials with Oroville Hospital did provide me with a statement claiming the notice provided does not have any immediate impact on the hospital's operations. This comes just over a week after Action News Now discovered a lawsuit between the contractors for the new tower, Modern Sun, and Oroville Hospital. I reached out to UMB for more information, and they provided me with the notice, which states that Oroville Hospital must immediately pay the bond amount, and that UMB has been directed by the holders to foreclose on its lien on the money held by it under the bond indenture. I reached out to both UMB and Oroville Hospital for confirmation on what this means, but the notice seems to indicate the hospital could be foreclosed on, meaning the property could be sold to repay the debt owed. I reached out to officials with Oroville Hospital and received a statement claiming the notice provided does not have any immediate impact on the hospital's operations. Hospital officials claimed they were under the impression that they had an agreement with UMB that certain bond funds being withheld by UMB would be applied to the debt service payment. Hospital officials claimed that instead, UMB applied a portion of the reserve funds to the payment, but continued to withhold the excess funds and served the notice. The statement reads in part, "Our discussions have centered on the hospital's request for a forbearance agreement as we work to complete construction of our new tower." I also asked hospital officials if there were any updates on when this new tower will open. They provided me with a statement that reads in part, "Due to Modern Sun's abandonment of the Oroville Hospital tower expansion, the completion of the project was delayed. We are working hard to meet the California Department of Health Care access and information's requirements that will allow the new tower to open and become fully operational. And while this notice has left us with some unanswered questions, we will continue to reach out to the hospital to keep you updated on any new developments." In Oroville, Bea Barbosa, Action News Now.
In another statement, hospital officials explained that UMB was only instructed to foreclose on the cash in the reserve account, which it has done. Hospital officials say UMB has not been instructed to foreclose on any other collateral, including the property itself. You can read the full statements from the hospital, Oroville Hospital Administration, on our website.